Alright, so this is the anterior compartment of the thigh. It has four big muscles called the quadriceps altogether. So the quadriceps include the rectus femoris. The rectus femoris crosses two joints actually. It starts up on the anterior inferior iliac spine and inserts onto the tibia, the tibial tuberosity, but the tendon that does it is called the rectus femoris tendon. No, it's the quadriceps tendon. Quadriceps tendon, and then when the quadriceps tendon crosses the patella, it's called the patellar ligament. The other muscles that you can see superficially are the vastus muscles. So on the lateral side, we have the vastus lateralis. This is the vastus medialis. These guys both come from the linea aspera. They originate on the linea aspera, and the insertion is the same as the rectus femoris, which is the tibial tuberosity. To find the vastus intermedius, you have to take this piece off, and the muscle here is a tendon, but this is basically vastus intermedius. That originates on the femur and inserts onto that same tibial tuberosity via the quadriceps tendon. Okay, so these are all of your leg extensors. Okay, so if we go laterally to the side, we will see this. This is still vastus lateralis, these two. What covers up the vastus lateralis is this band of connective tissue. This is called the iliotibial band, also called iliotibial tract. And this is a point of insertion for this muscle right here. This is your tensor fasciae latae, tensor fasciae latae. And so the tensor fasciae latae inserts into this. This band helps to stabilize the knee, and it's also the cause of IT band syndrome. Okay, as we go to the back, we have our hamstrings. Okay, so there's three major muscles here. If we're still on the lateral side, this is called the biceps femoris. On the medial side, the big one is called the semitendinosus. And the third muscle is called semimembranosus, which you can see here, and then also here. So semimembranosus is underneath the semitendinosus. The biceps femoris has two heads. We'll come back to here. Biceps femoris has two heads. This would be the long head, and then the short head, you would actually have to take this off. It's a little bit of trouble here to see the shorter head. Doesn't want to come off. Thanks. All right, there you go. There it is, right there. So it has a hole in it. There. So there's the biceps femoris. That's the short head. Okay, so we put the biceps femoris back on. And we can move on to the other muscles. So I pulled off the gluteus maximus. Okay, so this one has a really broad origin, iliac. The ilium, iliac crest, origins on the sacrum and coccyx, and then inserts onto the gluteal tuberosity of the femur, and also inserts into this IT band. Okay, so we take off the gluteus maximus, and this is gluteus maximus is a thigh extender and hyperextender. It also helps to laterally rotate the thigh, which is to turn your thigh out, and I'll take this off. So underneath the gluteus maximus, you'll be able to see the gluteus medius, okay, which is right here, has the hole in it. And then underneath the gluteus medius, we can find the piriformis. And this muscle is clinically significant because the sciatic nerve, which is this, comes out from underneath it. So if you have a tight piriformis muscle, you may have sensations running down your leg called sciatica. So it could be numbness or pain or weakness in the muscles. Okay. Gluteus minimus is not visible on this model. So let's put gluteus maximus back on, and then we're going to turn to the medial thigh. These are our adductor groups. So the one that's most prominent and superficial, this is your gracilis. Okay. Your adductor magnus is a very broad muscle. Here you can see adductor magnus, and here you can see adductor magnus. Here, this long one is called your adductor longus muscle. So all of these guys are your adductors. when we flip to the kind of into the front again, the anterior side, we have a very long muscle here. This is your sartorius muscle. It originates at the anterior superior iliac spine, runs across the hip, so crosses the hip joint, it crosses the knee joint, and inserts finally on the medial medial condyle of the tibia. Another muscle in this region, you can see right here, this is your iliopsoas muscle. So your your inguinal ligament will cross like this. The psoas major and the iliacus come together. As they pass by the inguinal ligament, they come out. This is iliopsoas. Now, this little guy in the corner here, this is your pectineus muscle. Okay, little one. This is a good view of your femoral triangle. So one border of the femoral triangle would be the inguinal ligament. Another border is the sartorius. And the third border is your adductor longus. So in this little window, this triangle, we have three structures you can see. So this is your femoral nerve, this is the femoral artery, this is the femoral vein, and then the last thing would be the lymphatics, which would not be visible in this model. Okay? So that's it for the thigh region. On the lower leg, or I guess the leg, here's your tibia. So this muscle here is the tibialis anterior. This one is going to help to dorsiflex, okay, and also it helps to invert, sorry. Here, next to the tibialis anterior, we're going to have our extensor digitorum longus. This one's going to extend your digits 2 through 5. Underneath it, the shorter one, we have extensor hallucis longus, because this one just goes to digit 1, or the hallux. To the side of that, we have our fibularis muscles. The one on top here is your fibularis longus. The one down here is your fibularis brevis. These guys help to evert your foot and also to plantar flex. Okay. On the back, we have your gastrocnemius. So these are the two heads. Gastrocnemius starts off on the condyles of the femur. So the origin of basically your lateral head would be the lateral condyle of the femur, and the medial head would be the origin is medial condyle of the femur. And these guys both insert onto the calcaneus via the calcaneal tendon. Okay. Underneath the gastrocnemius, we have the soleus, which you can see here. Here's the soleus. We can also take off one of the heads. I think one of these heads comes off, and you can see the soleus underneath. Ooh, we can take it off. Right. Whoops. So there's the soleus. What you can also see is the long tendon of the plantaris muscle. So the plantaris muscle would be this guy that's cut. Okay? Is that it? Oh, let's take it off. We'll have 3 more muscles of the leg, deeper muscles. So this one right here, that's the deepest one, this is going to be your tibialis posterior. And then this one, this long muscle here, is going to be an it's a flexor digitorum longus. And this one is your flexor hallucis longus. Okay, so you're responsible for these 3 muscles in the deep leg. I think that's it.